care of percutaneous catheters, and application of urostomy bag for caregivers. A percutaneous catheter is a type of thin, flexible tube inserted through the skin to drain fluids such as bile from the liver or gallbladder in cases of bile duct obstruction, stones, or infection. It also drains urine from the kidney in cases of urinary tract obstruction, stones, or infection. Lastly, it drains pus or abscesses. The tube is inserted under imaging guidance at Interventional Radiology Department. The items you'll need are pre-packed antiseptic swab sticks, urostomy bag, skin barrier spray, adhesive remover spray, C-shape adhesive tapes, alcohol swabs, scissors, and latex gloves. Start by performing hand hygiene. Prepare all the necessary items on a clean table surface. Cut the plastic film of the new urostomy bag base plate. Put on latex gloves. To remove the previous urostomy bag, gently peel the edges of the urostomy bag and spray the adhesive remover spray on the skin. Gently remove the urostomy bag from the skin and expose the drain exit site. To clean the percutaneous tube, clean the exit site and the surrounding skin with a single stroke and circular motion using the antiseptic swab sticks. Use alcohol swabs to cleanse the external percutaneous tubing and allow it to dry. Apply a skin barrier spray to the surrounding skin and allow it to dry completely. Use the threading technique of applying a urostomy bag. Remove the plastic film and paste to base plate to skin. Apply a C-shaped tape along the rim of the base plate. Let the patient remain in position for 10 to 15 minutes so that the base plate can adhere to the skin. Remove gloves and perform hand hygiene. Here are some things to look out for: fever of 38 degrees and above, presence or increasing redness, swelling and bruising at the drain exit site, severe pain at the drain site, allergic skin reaction from urostomy bag base plate or antiseptic cleansing solution, dislodged anchoring suture. If you encounter any difficulties or issues, please contact the SKH Hotline to make an appointment for an outpatient review with the respective specialty nurse.